Hello, and welcome to Intimacy Evolution. I'm Brianna Carey, one half of this show that I co host with my husband, Mark. If you're new to our show, we're excited to have you join us. And if you're not new, welcome back and thanks for supporting us. Today's conversation was a little surreal, kind of bittersweet, and I'd even say validating for me because it's a conversation I wish I could have had during my pregnancy and postpartum journey. In this episode, I had the pleasure of chatting with Dr. Kelsey Beach, a pelvic floor physical therapist that specializes in educating and supporting women during pregnancy, birth prep, and through their postpartum healing. I've mentioned on here before how my postpartum experience with our first kiddo is what led me down the path of seeing the importance in supporting couples during this season of their life. In our coaching business, that's helping them to navigate the shifts in their relationship and intimacy. And part of that support is absolutely making sure that they are fully supported in all areas, especially the preparation of birth and the healing after. This episode is packed full of amazing information. So many tips. You're going to want to take notes. We cover everything from preventative care during pregnancy to the stages of birth prep and what to expect during the postpartum assessment and healing process. And towards the end, we touch base on the big topic I hear a lot about, pain with sex. How to go about the first postpartum sex session. Ooh, that's a tongue twister. And how can you and your partner be prepared, and tips on how to make it more enjoyable for both partners. If you know someone in this season of life, please click that share button. If this resonates with you, I would love to hear your story. Please email me or send me a DM on Instagram. I know I felt alone on this journey, and my goal is to make sure other mamas or expecting moms come into this season feeling empowered with answers, that they have a clearer direction of what they want their pregnancy and postpartum journey to look like, and they're prepared with resources to advocate for themselves and their health. Let's get into the episode. Welcome to Intimacy Evolution with Brianna and Mark Carey, where they discuss desire, intimacy, and how to embrace the changes within your relationship. Brianna has been a sexual health educator for 14 years and is currently working as a relationship and intimacy coach. Mark is a licensed professional counselor and has been running his own private practice for 6 years. Together, they have 2 young kids and have dealt with the many ebbs and flows during their 15 years together. Intimacy evolves over time, and that's okay. Let's talk about it. All right. Welcome to Intimacy Evolution. Today, I am joined by Dr. Kelsey Beach, who is a pelvic floor physical therapist that focuses on supporting women during pregnancy, birth, and postpartum. Welcome, Kelsey.
Thank you for having me today.
Yes, I am so excited to dive more into this topic with you. It's something that I'm very passionate about, and I cannot wait for you to just share all of your wisdom with our listeners.
Awesome. Let's get going.
Yeah.
Let's dive in.
Yes, please. So please tell me a little bit about you and how you got onto the path of doing the work you're doing today.
So my background, went to physical therapy school, almost 12 years ago, had zero intentions of ever being a pelvic health, women's health therapist. My whole idea was outpatient orthopedics. I grew up a huge athlete, done rehab myself. And I thought that's what I wanted to do. I wanted to work with big time athletes, rehabbing them, and then started learning about it. And I just thought, man, this is really boring rehab. And got into it in PT school, learning about pregnancy and physical therapy. And I thought, oh, well, this is something interesting and different. And, the clinician has a lot more autonomy to make decisions. And I was also learning no one knew about their pelvic floor. One of my projects for school was going to teach the local community about pelvic floor during pregnancy. And the first question I asked was, who knows what their pelvic floor is? And no one raised their hand. And granted, this is small town, Missouri, 14 years ago. Mm-hmm. And it was crickets. And so I thought, whoa, there's a need for this. So all of my projects evolved into gearing on like women's reproductive health, and then did a clinical in pelvic health and thought, whoa, this is where I belong. So I came out of school specializing in pelvic, which is not common, and have not looked back.
Yeah.
My background is actually more in high chronic pain, constipation, and even pediatric bowel and bladder dysfunction. And that's where the bread and butter of my career has been. Then, gosh, COVID hits and saw an opportunity to leave where I was at, quit my job the same week I found out I was pregnant to launch a business. And still had intentions of actually working with athletes. Kind of what I wanted to gear my business towards was the active female athlete, because that was me and that's what I knew. But as I grew into my pregnancy, I almost, revert back to PT school and thought, no one's talking about this. No one's talking about the biomechanics of how your body physically changes during pregnancy, during birth, and then during postpartum. We just say, oh, well, you had a baby, it's normal. Oh, well, that's just part of being a mom now. Yep. And my journey during pregnancy, my birth journey, my postpartum journey, all evolved this business. And so I think like 2 months into my business, I fully rebranded and geared it towards really niching down into this acute phase pregnancy, birth, postpartum. We see everything else, but that is now where my passion is educating and rehabbing the maternal body. And I'm still just, even now in my second pregnancy, we're still just not talking about it. Like our providers, our birth workers, their job is to get babies out. They do an amazing job. I mean, I am not meant to birth babies like on the receiving end. Yeah. But the rehab component of it. So that's kind of in a nutshell where I've been and where we're going. And now my passion is just educating women about what the heck happens to their body during this perinatal phase, because it's crazy.
Yeah. Oh my gosh. I just resonate so much with all of this. Everything you said, like, that's kind of when my journey started shifting too, was when I had my first baby and realizing, just a little background. I know our listeners have heard this, but just to bring you kind of in on little points that I'll be asking questions about. It's like, I had a 2nd degree labial tear, obviously had pain with sex. And my midwife, her suggestion was just to have a couple of glasses of wine, relax, and use more lubrication. So felt totally dismissed. And I, at that point, had been in the sexual health field, teaching women, right, about sex and relationships for about 8-9 years. And I was just astonished that this was the advice.
Oh, that's the most common advice, is a glass of wine.
Yeah.
Lube is great advice.
Right. Definitely.
Wine is not.
Right. Right. For multiple reasons. But yes, I'm with you on the fact that this is not being talked about at all. And I had to do a lot of research myself and advocating. And I didn't even, after my first kiddo, seek pelvic floor therapy after that. I did a lot of self stuff to help myself heal. And it wasn't until I was a year postpartum with my second baby that I asked for a referral for pelvic floor therapy because it still was not offered.
No. And it's an interesting world of kind of the way to describe it. Like your OB, your midwife, your husband, who, if you yourself are catching your own baby, like whomever's on the receiving end of catching your baby is not responsible for your pelvic floor. But unfortunately, we've lived in a society where we've had to depend on them to be our referral source. And luckily now, like coming out of school with doctorates, we're breaking that mold and we're allowing people to come see us without the means of having to get a referral. But unfortunately, that takes women researching it on their own, which is great. But the rehab world in the perinatal demographic is a really big buzzword right now. Like everyone wants to be a pelvic floor specialist or a perinatal pregnant postpartum specialist. And so we're putting all this out there online and women are thinking they can treat themselves, which some of them can.
Yeah.
But pelvic PTs, we're just able to get down a whole deeper layer by being able to do internal pelvic floor assessments and help sort through this. And so the narrative is changing, and we're allowing women to see us off the streets without the referral. But we're still unfortunately counting on our birth workers to say, oh, well, you need pelvic PT.
Yeah.
And so luckily that's changing and molding, but it takes a long time. And I mean, truth be told, no one wants to talk about their genitals.
Right. Well, I think that's just the whole thing, another soapbox for,
agreed.
Inclusive sexual health education, right? It's very important. If we're not learning about that from the get-go, of course, we're not going to be comfortable talking about it later on down the road too. So I just love that you're stepping into really sharing more about this. And I have some questions for you. So when is the optimal time for a woman to start looking into pelvic floor therapy, either during pregnancy or postpartum?
So I love seeing women preventively during pregnancy, and I treat following the trimesters. So in the first trimester, it's a really beautiful time to come see a pelvic floor PT and just learn what the heck you're going to be going down the road to. First trimester is a really messy trimester of hormonal changes. You don't feel good. Your body's starting to make big shifts, and it's really starting to learn what's about to change. When we look at that biomechanically, there's not a lot of changes. So women during the first trimester, if you don't see us during that time, but if you want to just kind of say, hey, I'd like to start getting educated, that's a beautiful time. During that second trimester, we know the hormones have started leveling out a little bit. So this is kind of a time where we can really get after posture management, bowel management, because a lot of times we see constipation start really rearing its head, strengthening of the pelvis. As those hormones level out, it's a really good time to start learning what we need to do to stabilize the pelvis. Because then as we turn third trimester, we know the hormones peak up again to say, hey, body, we actually need to start having a baby, which means we really have to start like relaxing down, having our relaxing kick in, which that's when the muscles inadvertently just go, what? So kind of getting ahead in the second trimester is a really great time to start because we start seeing a lot more changes in growth, changes in posture, changes in center of gravity, a little bit less of the strength component. So getting after it in that time. And then third trimester is this interesting mix of continuing with that strengthening, but then also we hit pause around the 34 weeks and say, okay, let's lean into the fact that the body needs to have a baby. Let's birth prep you. We're seeing more and more clinicians start doing birth prep from a physical therapy standpoint. So doing that during the birth. And then I tell women after birth, your body needs to naturally heal. Don't mess with it. You know, the first 4 to 6 weeks is your body needs to learn how to just cool its jets, figure out what the heck to do with this baby. And then we like to see moms usually around the 4 to 6 week postpartum just to get an assessment of what their new body looks like. Your body's never the same after a baby. We don't bounce back to where we were. We have this beautiful new body that's been this powerhouse of a temple that birthed a child, whether vaginally or cesarean. And so just learning, what's this look like now? You know, things change. What's the common place for where your body should be? What might be a little abnormal? What might need to be fine-tuned? And sometimes what can we just continue to like expedite the healing? Bodies heal beautifully on their own. Like women's bodies know how to birth babies. Like they are capable of doing it. They know how, but sometimes just a fine tune here or there can just expedite the healing and give mom more knowledge. We're fear mongered a lot about what happens to our bodies and just saying, hey, that's actually part of the game. Like, let's lean into it. Let's mold this a little bit and make it not so scary and give you the proper therapeutic interventions just to keep riding this healing train. So to answer that question, I love starting to seeing you at the second trimester. I love birth prepping you during that late third trimester. And then that 4 to 6 weeks postpartum is a good time.
Yeah, I love that. I would love to zoom in more on birth prep. What does that actually look like?
So birth prep, like birth right now is my passion in PT. I could go on about this. So in the birth prep that I teach, what we're looking at, it's 3 stages. And the first stage of birth prep is we just talk about how I teach the stages of labor. And in each stage of labor, what your body is going through. And in that we talk about, the first stage of labor, early active transition. We're really wanting to preserve the pelvic floor and save some tank in the gas. So we talk about diaphragmatic breathing, how to passively move the pelvic floor with our diaphragm, what movements are important during this phase, how to fuel during this phase, because birth is kind of the marathon that you really didn't want to sign up for, but your friend calls you one night. She's like, do you want to run this race tomorrow? And you're like, this is the best idea ever. I've done no training. Right. That's birth. That is 100% birth.
Yeah.
So we talk about kind of almost the night before the race. What does that look like? How to fuel, how to actively rest, how to breathe through it. And then once stage 2 hits, how to actually push. So many people have this idea that a strong pelvic floor gets a baby out. It doesn't. A pelvic floor has to get out of the way to actually let the baby come down through the birth canal.
Yeah.
So we talk about what pushing looks like versus an open glottis push versus a closed glottis push, which is just simply that vocal cord, leaving it open, leaving it closed.
Yeah.
And why actually both are beneficial. I am not a proponent of saying you should not do this. I'm a proponent of saying, here's all the tools in your toolkit. You get to decide that day what works best for you.
Right.
I had to close glottis push my son out because after almost 2 hours of pushing open glottis, he didn't want to come out. So my midwife, she's like, get on your back, bring your knees to your chest and start holding your breath. And I said, okay, this is the tool I need now.
Yeah.
So we talk about that. Then I love talking about birth positions, labor and birth positions. We are so innate to think birth is meant to be on your back, legs in a stirrup, knees to your chest, like I just said I did, the whole entire time. And you have so many options. And a lot of women don't even connect with their pelvic floor in that position. We've seen over my career, sometimes in that laying down position, people are like, I don't even feel my pelvic floor. But if we move you, if we try different positions, you have a better connection piece. So I love to talk about what labor and birth positions are, both epidural and non-epidural safe positions. Because I love my moms that are like, I'm walking in and I'm immediately asking for the epidural. I'm like, perfect. You know what you want.
You know what you want.
Here's how you can move about in bed safely. Here's how to have an open communication with your provider about it too. That says, hey, here's what I really like. What are you okay with? And then the last part of birth prep, we talk about internal versus external hip rotation, because both of those open the pelvis a little bit different for the baby to come out during different fetal staging. And then triplane motion. The baby has to traverse at least 2 planes of motion to come out the birth canal. They have to go through flexion and extension and rotation. And so how we can actually move our hips to allow that movement to happen, and just give baby just a little bit more space. The more I always kind of tell my girls, like, you are a rotisserie chicken that day. Like, you need to just constantly be moving, like in different positions, asymmetrical, symmetrical, and just how to use your body to birth a baby. I mean, I was not taught any of this. I've never heard, we're seeing more and more PTs come into this, but I wish I would have known this when I was birthing my kiddos. Oh my gosh, it would have made a whole world of difference. And the thing is, like, and I tell everyone, like, in the birth prep world, like, we can have a plan and it's probably not going to happen. But as long as you show up to birth with this beautiful toolkit to be like, hey, these are my options. This is what I can do. You know, my son was sunny side up and I couldn't get off all fours. And I had this huge idea of I was going to be in the tub and I was going to move, and I could not get my butt out of the air. And that's where so I learned how to move during that. And so just knowing, like, oh, this tool's really working good for this stage, or even this hour, just picking through it and piecemealing and just letting kind of moms know, like, you have a gamut of information that day. You don't have to show up and just ask the nurses or your OB, like, hey, what do I do? And there's nothing wrong with that if that's how you want to birth. But just my gals that want to have really informed birth, like, the birth prep just talks about, like, biomechanically, what is your body doing? And that is just the biomechanics of birth right now is just where my passion's at, because there's so much movement that can be had to facilitate a little bit better movement for not only mom, but also baby to come out.
Yeah. Oh, I feel like that would have made a world of difference, especially, well, both my kids got stuck, but yeah, like my body, like your body naturally knows different movements. It moves in a way like you don't even understand, like you're not conscious of, you know? And so
No.
I was standing with my daughter and I started that active labor and I was bearing down and there's just a sound, a primal sound that comes out of you. I literally had 6 nurses surrounding me after they heard that. And I really wanted to just squat and push. And I feel like it would have been a lot better because they had me up on the bed. And from the moment that that happened to being on the, like she was born in 5 minutes, but it seemed like forever because she got stuck. Her heart rate started dropping and she came out and she ended up having a black eye. She was all swollen. And then she ended up having, I'm pretty sure, some nerve damage from that because that left eye was always kind of droopy for the first, few years and even still. And I feel like had I been able to birth her in that squatting position, she wouldn't have gotten stuck.
And that is what I tell my patients is what you feel right that day is probably right. Your body, and I was the same way, like the sounds I was making.
Yeah.
Like I tell people like I sounded like a heifer back in the pasture in heat by herself. Like the primal visceral sounds, but like tangent, the research shows low tone vocal sounds also actually stimulate more pelvic floor relaxation as opposed to high tone vocal cords. And so, you know, if we hear like in most movies, we hear
that
them
growling,
like,
kind of like we're like that versus
that low tone. Yeah.
Versus what we see in movies, right?
Exactly.
Like, and then they're like, you did this to me. Like,
yes. And that the low tone vocal cords actually, and the vocal cords have a direct connection to the pelvic floor. Like that stimulates that pelvic floor just to say move. And so I tell moms, I'm like, make whatever sound you want, you know, like you like day of birth, you step out of your body and you become someone you did not know you were. Yeah. And let that happen. Lean into that. And if something feels right that day, do it. As long as it's safe. My number one rule is like, I don't catch babies. Like, so that day, your baby catchers, your birth team, it has to be safe to them. But have a communication, you know? So for you, like if you were safe squatting, you should have been able to. Yeah. But unfortunately, we live in a society where it's not always the case. Like babies have been born on your back holding your breath for years. Like they're not really teaching anything different in the birth world school, which is fine. But we're now seeing more kind of wellness workers come out of the woodworks and be like, wait, there could be a better way for her that day than what we're just like birth does not fit in this beautiful box. Like it's actually not even that beautiful. Like it doesn't fit in this box. There's so many multifaceted components going on. And you're right. Like that day, if that position felt right, like that's probably where you should have been. Right. We're just not taught, hey, you can speak up that day and you can actually fire any nurse you want that tells you no.
Yeah. Like there was a lot of things with that 100% birth experience.
And birth is messy. It's scary. Like, and you know, the day, and I talk to a lot of moms, like if you have a doula or if you have like your partner present, like make them responsible for knowing what you want. Like my husband was the firing squad in our birth. I'm like, if I don't like someone, I can't fire them, but I need you to. I need you to, and he was like, okay, I can do that. And so we were lucky. Our birth team was amazing. Like we could do pretty much whatever we wanted, within reason. But and the same thing goes with pushing. I have moms that say, oh, I felt the need to push, but they told me I wasn't ready. You know, I wasn't dilated enough. I'm like, you should have started pushing, but you can push in a more passive manner that's not so aggressive to help facilitate baby coming down. And so that, like I said, my passion is just education on what your options are, what your body's going through, and how to have really safe, open communication with your birth team that day. Yeah. And I love that you offer birth prep for that. So that way, because I feel like a lot of it, and I'm totally not discrediting or knocking anybody that is wanting an epidural. Yeah. However, I feel like it is chosen out of a fear that it is going to be so painful, they're not going to be able to handle it. Yeah.
Whereas I feel like if there was a proper, like, what you offer, birth prep to mentally really connect with their body, they might feel more confident in themselves.
Agreed.
So, and so just that little tidbit, if, just being more prepared, and then also getting your partner on board and understanding. And that's one thing that is my passion, is bringing that partner, especially a male partner, into the education part of here's what's going to be happening. We come from it from a relationship and intimacy part, but explaining the changes of the body and what they're going through and how that's going to affect the relationship, through birth and postpartum, but also having them on that journey from the very get-go, understanding and advocating what's in her best interest during birth, I think is so powerful.
Agreed. And I tell a lot of my moms, like, guys don't know what to do during labor. And they'll be like, what can I do? And usually the female answer is like, nothing right now.
Right.
Like my husband's role the day of to fire and to feed me. Like he was on food and drink patrol and he would just be like, drink. And I was like, oh, okay. Thank goodness I forgot. And I had a hip surgery 2 weeks before I found out I was pregnant.
Oh no.
So he was also on hip patrol. So he knew he had to tell everyone, he's like, you can't touch that hip. I know you might want in this position, but that was his job. And so, I mean, understanding like birth is a very primal, like maternal thing, but involving your partner in really small ways makes it so much more like intimate, safe, productive, and just collaborative. And it gives moms and dads just such a cool way to connect and be like, gosh, we did this together.
Yeah.
And I think that's such a cool part. And so I touch on that lightly in that birth prep session with moms.
Yeah, I love that. Do you ever find yourself caught up in the hustle and bustle of life that you can't remember the last time you and your partner had sexy time? Or that you enjoyed a solo pleasure session? Maybe you have thoughts like, I don't really care if we even have sex. First, I want to say that you're not alone. I get it. Life can be rather exhausting, and sometimes sex is the furthest thing from your mind. But really, it's something you need to make time for, just like you do everything else. Not just because you deserve to feel good, but orgasms provide so many amazing health benefits that could help alleviate a lot of the stress and other struggles you might have. Easier said than done, right? This is where I can help. I'm offering an 8-week program for women that are ready to reclaim their desire. It starts January 11th, and you can find the link in the show notes to get started. I look forward to seeing you there. So let's move on to the postpartum. So you would like to see the mom about 4 to 6 weeks to do an assessment. And then what are some things that you're looking for during this time? How are you guiding them into their healing journey? And what does that process look like?
So during that initial postpartum assessment, we're looking at your back, your hips, your core, pelvic floor, external and internal. Holding a baby is really hard. Nursing, whether you're bottle feeding, breastfeeding, I don't care. Feeding a baby is hard. We're in this position constantly.
Hunched over,
even talking about like opening that chest up, mechanics of holding baby. I love to talk breastfeeding positions for my moms who do choose to nurse, and bottle feeding positions for my moms who choose to bottle. We love to talk about that. We look at your core. The dirty word is diastasis recti, abdominal separation. It has to happen. So educating on the fact that this has to happen, giving you a grade with it and saying, here's how we now start doing really gentle core contractions. With the pelvic floor, we're looking at if there's a prolapse, which if you did have a vaginal birth, you do have a high incidence of one. What the tear site, if you did tear, looks like, how the healing looks, how the tissue looks, and then what the pelvic floor contractions and elongation patterns feel like. And in those first kind of few visits, we're just really nurturing a gentle pelvic core contraction with a couple different positions to really start bringing this pelvic core back together mildly. in this initial 6 weeks, I'm not getting after it. Like we're still leaning into this gentle healing process. We're talking about tissue management, scar management. So my mom's with cesareans, how to start desensitizing the scar. If we did have a tear, how to start desensitizing the tear, how to moisturize the vulva, how to moisturize the scars, and just talking about the stuff your OB's not talking to you about, like what the body does. And I tell my moms, like, if your baby came out and they got you stitched up, like quick, fast, ready, and everyone's healthy, like your OB did an amazing job. Like that is their job and they did perfect at it.
Yeah.
But then transfer of care moves and it goes to saying, now let's really get into like the smaller musculoskeletal and tissue components of your healing and what's that look like. And then that first visit too, we also assess, what are your goals? Is your goal just to put your baby in the crib without pain? Or I had a mom 6 weeks postpartum. She's like, I'm running Boston in 6 months, Boston Marathon. I said, okay, girl, let's do this. So, I mean, really just learning what are your goals and how we can build this plan of care that's really tailored to you and what you want. Everyone has just a different maternal goal. And like I said, some moms are just say, I want to pet the baby down with no pain, or I just want to learn what the heck happened and how I can continue to facilitate healing and just getting to know them and what their wants, needs, and desires are and building that plan of care that fits their lifestyle and their needs. We usually see moms, like I said, that 4 to 6 week visit postpartum. We usually see you for 4 to 6 weeks after that. We don't want to ride around with you your whole entire year unless you want us to. We will happily will. But we just want to build you this base of education in this acute postpartum phase and then say, where do you want it to go? And how can we walk alongside you to get you there? And then when that time comes to release you, how can we open that next door to make sure you have the right providers, resources that you need to take that next step?
Yes. Oh, I love that. I want to jump to this part real quick. And then I have a couple of other things. So this is something that I see a lot of, and can stem a lot of frustration and disconnect within the relationship is postpartum sex, pain with sex. And so this is again where I really try to facilitate partnership, right? And letting the male partner really be aware of what's happening to the body and the repair, because I joke that the 6-week appointment is like the only date that guys remember, right? They're 100%. Like, okay, you're ready.
Are you cleared?
Right? You're like, no, please don't touch me. Right. And so that is a process for a lot of women. It starts to develop into a lot of guilt and shame and confusion for women because they're like, why is my body not responding how I want it to? My partner has been waiting. And I'm like, well, you're still healing and still taking care of a tiny human. They can continue to wait. And that's where we talk about, different ways to facilitate intimacy. That's not just sex, but when they are ready to start initiating and they're still having pain with sex, what are some things that you would recommend or tips or just anything you have on that?
So that is just a whole different can of worms, postpartum sex. And I love talking about it as well. So my first thing I talk about is no expectations. Like your first time back in the sack after a baby is literally pretty much like the first time you've ever had sex. Have zero expectations. Talk to your partner that just says, and just say, no one needs to get off. We just need to almost relearn each other's bodies and have no expectation. And that's sometimes where a glass of wine can come in, but it's not a treatment. But if you guys just want to sit down, have a glass of wine together, laugh about this journey, beautiful. And I also love neutral words during intimacy. So if she has pain, it's not, oh, stop. It's, can we pause?
Yeah.
Can we take a second? Can I breathe through this? Once we say stop, like he sees a red light, he panics and says, am I hurting you? And then she's going to hear that question, be like, I don't know. Are you?
Yeah.
And then the brain triggers this response to the body that says, ooh, something's not right. Let's tense. So even if you have a beautiful, healthy vulva, vagina after a vaginal delivery or cesarean, if we start getting enamored with questions of, are we not safe? The brain says, no, we're not.
Yeah.
So I love talking about neutral words with pausing, breathing, grounding yourself as well to the room. So be sure that the first time back, it's in a space you guys are comfortable being intimate. If before you were always intimate in the bedroom, be sure that we're intimate again in that bedroom. Don't be like, let's get really wild and do it in the kitchen this time, because your brain doesn't ground that space. Your brain doesn't see that as this is a safe space that we're intimate. Lubrication, your body, even if you choose not to nurse, your hormones are still figuring out and ridding of prolactin, which means your estrogen is depleted. So we see a really high incidence of vaginal atrophy, which just means that tissue's not happy. And then my nursing moms, their prolactin's all over the place with nursing. So estrogen stores are down, which means that tissue's just a lot more highly irritated. So using a vulvar balm in the days leading up, using a vaginal lubrication that day, both on him and on her, is really good. And then learning just how to breathe through the discomfort. I don't like the minute pain hits, we pull out. I love the pause. He rests in that vaginal vault. She sees if she can breathe down through it. And if so, let's resume. And if still up, then we can be done. But we don't if we throw that red flag, that flag on the play, the body's like, we're done. We're not getting back into this. And then what happens then is the brain holds on to that. And the next time she goes to be intimate, the brain's going to open that intimacy file and be like, hey, remember last week we had a lot of pain? That's what we remember. Guard. So it is this multifaceted component of what the brain and body can do. But I don't even know if I answered that. I get a pelvic floor assessment. That's the number one tip.
No, that is I'm getting very emotional right now hearing you share this, because that's exactly what I had to discover myself. I had to walk myself through, because it took 6 months postpartum, 6 to 8 months postpartum to where it finally felt comfortable enough that we could resume for a longer duration. And I did have to learn to, relax with some vibration to relax the muscles and,
great,
to use the words pause and to breathe into it rather than tense my body and say, nope, stop, you're done. Because that's how it was at the beginning. And having somebody that would have prepared me for that from the get-go would have saved us so much struggle and heartache.
And it's such a hard journey. And there's a lot of shame around what your vagina looks like after a vaginal birth. We're always hurt, oh, it's going to stretch you out. Oh, it's going to, and I have a prolapse. And so I've got an organ that hangs down and I'm still shameful of can you feel it? We see a lot of women who are still initially leaking as well in that early postpartum phase. So there's just a lot of questioning about what your body's even going through in its healing journey. And so that's what's hard. Your brain's not focused on, oh my gosh, I'm so excited to be intimate with my partner again. It's usually focused on, is the baby sleeping? Is the baby going to wake up? Where is the baby? Am I going to leak? I'd leak milk when we were intimate because I was just a leaker. Am I going to leak urine? This hurt. And then, so your brain's not even present. And that's where the grounding comes in to really help and just say, and that's why I tell moms, have no expectations. And as you said, learn the intimacy spectrum. One of my favorite things to do with my husband is lay in bed and read together at night. That's one of the most intimate things we do. And making sure we were doing that more before penetrative intercourse was so important to get my brain used to be he's not the bad guy. No one's the bad guy. This is just the walk that we're on right now. And it's so hard for women to understand that and then relay that to their partner. And it's messy and it's really chaotic. And I tell moms, I'm bring your husbands in, bring your partner in. It's sometimes nice to hear it from a third party that's not in the sheets with you guys to just say, this is part of the game. It's going to take 6 weeks means nothing. 6 weeks just means the wound, if there was one, especially when what we really don't talk about, it's the wound from the placenta that we're mostly concerned with. We're really looking for that placental wound, which is the size of a dinner plate on the inside of one of your organs. Is finally healed. You're no longer bleeding. so we can now we can resume intercourse.
Mm-hmm.
And no one's talking about that. Like, we're not really having discussions about that. And healing takes, like, when our body's healing, and if we're nursing, our vaginal lubrication stores have zero concern.
Yeah.
We don't care about healing. Like, we care about, is our baby fed if we are nursing?
Mm-hmm.
And then our circadian rhythms, are we established in that? How are we feeding the hormones of the new maternal brain?
Mm-hmm.
Not how are we getting laid?
Yeah.
And it is just messy. And yeah, helping women and their partners just better understand, like, this is not a straight line back to the bedroom. It's some days you're going to be like, man, I feel great. Other days you're like, don't even touch me. And that don't touch me might hang out for
a while. Yeah. Wow. Yeah. Yeah.
And I mean, I remember nursing around the clock thinking, I can't have anything else touch me today.
That touched out. Yep.
That touched out feeling. And so navigating that is just so interesting, and just having open conversations and about what does this new journey of, it's your new body. What does it look like? And that's part of that is resuming intimacy with your partners and
yourself.
Yeah.
Getting comfortable with yourself, getting reacquainted with you.
Yeah. My body. I always tell moms, like, and I'm the first to comfortably admit, I don't like being pregnant. It is, I don't feel, I feel like something is not mine. That's been mine for 30 some odd years.
Yeah.
And postpartum can be the same way. I mean,
yeah.
And so making that a comfortable conversation to say, like, it's okay to not like where you're at. Like, you don't have to love this moment that we almost say is like all puppies and rainbows and the most amazing thing. Like, I love how I'm the very just kind of direct mom of like, I don't like it. It's not for me. Like,
and owning that, and that's okay.
Yes. And making just other people hopefully feel comfortable as well. In the journey to just say, oh, okay, might just be the season. And then opening the other doors to say, hey, I know enough about what's going on with the body. Like, let's maybe explore some other avenues of mental health therapy, sexual and intimacy coaching, to say, let's also get some other people on board for this journey with you to know how to resume it. Because I can take care of a pelvic floor, a body all day long. But when it comes to the journey to reestablishing what a couple's intimacy looks like, that's not my forte. And so also just, getting women in the door to say, let's close this journey that you and I've been on, but let's open this next door to kind of see who can help walk alongside you next.
Yes. Oh my gosh. A support team. I love that. It's so important. I feel like every person needs to have their support team, because
agreed,
we are not meant to go through life and these experiences alone. And
we're not.
We're kind of made to think that way. So I love that the more conversations are being had about that not being true.
Agreed. So. The narrative's definitely changing of looking at the village and building the village, but also knowing who needs to be in your village at what time.
Yes.
That's the other thing. And I had a conversation with a patient this morning and I just told her, like, rank me. Like, I don't have to be number one on your birth team. Like, you get to decide where I rank each week. If I'm not important that week, don't make an appointment with me. Like, that's okay. And educating too, that everyone, you might need a different provider at a different stage on your journey. And you ultimately get to decide who those people are. And if they want to walk alongside you on that journey, like, they're going to know when to pause, they're going to know when to walk. And they themselves are also going to know when, like, our time's over. Perfect. Or who can I open the next door for you for?
Yes. Oh, I love that so much. Good. Oh my gosh. This was just filled with so much amazingness. And I'm just reflecting on how previous pregnant postpartum Brie would have loved this information. And so I'm just really excited to share this with our listeners and get this out there and share this message. And so I just thank you so much for being on here today and sharing all of this.
Thank you for having me. I'm excited as well to share this with my moms.
Yeah.
That, like I said, I know when my journey with them might be over, but now knowing, like, we have a resource of an intimacy coach in that postpartum world, like, I want to open that door for them.
Yeah, thank you.
You're
I
welcome.
do want to, before we go, um, what is something that you would have loved to tell a younger version of Kelsey about sex, relationships, or pregnancy?
Man, do we have enough time for this? Oh my gosh. I think looking back, man, I don't even know. Like each one of those things, I could think I could tell myself something different. But I think with like the whole pregnancy, birth, postpartum phase,
Mhm.
it's okay not to like it. I think I felt a lot of pressure of like, this is such a beautiful time in your life. You should cherish every moment of it. And I had a lot of mom guilt, like a lot of mom guilt. And so I think I would have told myself, lean into your emotions.
Yeah.
And if they're not pretty, that's okay. And I think that would have really helped my brain, my new mom brain, in my initial 6 months of postpartum, just to say, you don't have to do this like everyone else,
Mm.
and figure out what works best for the way that you want to navigate this, and find the providers who will support you figuring that out, not bowing down to the pretty like Instagram feed bullshit of what it should look like. Sorry, excuse my language.
Yeah. Oh, you're fine.
I think that's where that it's okay not to like every stage, and find their providers who will support you in that.
I 100% agree. Yes, that.
Mm-hmm.
Yeah. Oh, that was beautiful.
Right. Thank you.
Oh, thank you so much, Kelsey, for joining us today. Please tell our listeners where they can find you and how they can work with you.
So you can find us encoretherapykc.com. That's our website. We have a little intake that you can fill out. Once you fill that out, I will contact you. We'll talk about what you have going on and see when we can get you scheduled. We're also on social media, Encore Therapy KC on Instagram. Follow along. We love brutal, honest momming, and we'd love to work with you in whatever capacity we can help you with.
Thank you so much, Kelsey.
You're welcome.
Yeah, I look forward to talking with you, working with you in the future. Thank you, everyone, for joining us today, and we'll see you next week. Bye. Thank you so much for tuning in. We hope you enjoyed the show. Make sure you hit the subscribe button so you never miss an episode. If you found this helpful, entertaining, or both, please take a quick minute to give a rating and review. That would mean the world to us, and it helps other beautiful humans to find our show. We'll see you next week.